Welcome to laserspine.in. Recently, some of you might have noticed we have started giving free online consultations to people in need during this time of pandemic. During our interaction on these free online consultations, we realized that there is a lot of myth about low back pain. And this video is just to solve those myths. We have taken some of the common questions we got during our chat or during our previous conversation with our patients and in trying to get to you just to make you understand some of these answers. So I'm Dr. Ayush Sharma, and today I will be talking on low back pain myth busters. These are some of the things we'll talk about. What is the common cause of low back pain? When do you need to consult a spine specialist? This is again a very common question. Doctor, do I need a spine surgery? And the last but not the least, and the most controversial of all, how safe is a spine surgery for back pain? So let's start with understanding the cause of low back pain. And even before we venture into it, let me ask you a question. How many of you have ever suffered from a low back pain? And if you are one of the persons like me who has raised his hand or who have ever suffered from a low back pain, you are not alone. Low back pain is the most common cause of disability worldwide, so much so that it is more common than war, even more common than something as common as diabetes. And it has been well published, well documented in papers, in some of the journals. And that's why it is such a big burden to the society. Now, let's start with understanding some of the common causes of low back pain. And this is the list. Some of the most common causes can be mechanical low back pain. It could be a metabolic disease. It could be a degenerative problem. It could be due to infection. It could be due to injury or a trauma. And it could be inflammatory as well. Now, of all these causes, the first three are the most common. And that's where we will focus today because these first three of these causes will cover almost 80% of the causes of low back pain. So let's start with understanding the very first cause and one of the most common cause, the mechanical low back pain. Now, this is how our body was supposed to be, but unfortunately, this is how most of us look today. And this pandemic has not helped the cause. So the problem here is with the biomechanics of the spine, and that's why it is called the mechanical low back pain, where the very issue comes from the problem starting with the biomechanics of the spine. So normally your spine should have been like this, and you should have a very good posture. You should have a very good sitting habit. But see what happens because of our dependency on a computer, because the way we are today, because we are not doing enough, we are not doing enough exercises. So once in a while, you get a pain in your back which is because of a wrong posture or because you have lifted something up in a wrong way. And this is one of the most common cause of the low back pain, which can be corrected just by improving your posture, your body habit, by doing exercises. And this comes in the group of mechanical low back pain. The second, again, a very big cause of low back pain are metabolic cause. And again, these are very easily missed out cause of low back pain. Now, vitamin D is a very important vitamin which we need every day for our bones to be healthy. It is not something which we find in our day-to-day food, like in milk and fish. Not only that, it is very readily available if you go out in sunlight for 20 minutes. But unfortunately, due to our eating habits, due to us being in home all the time, most of us suffer from a vitamin D deficiency. and that itself can lead to low back pain. And this can be again treated very simply by taking food which is rich in vitamin D, and sometimes we need to supplement you with vitamin D tablets. Again, osteoporosis. This is called a silent killer. So, what is osteoporosis? Osteoporosis is nothing. It is a part of the aging process where if you see this bone, this is how the bone looks like when you are 20 years old. And this is how your bone looks like when you are 70 years old. So basically, there is a weakening in the structural matrix of the bone, which is called osteoporosis. Now, why it can lead to back pain? A generalized osteoporosis itself can sometimes lead to low back pain, or rarely or once in a while, it can lead to a osteoporotic fracture, which you see here because the bone is so weak that bone simply crumbles, and it can happen without even a major trauma or major accident. So again, if person 60 or 70-year old, he is getting up from bed and suddenly he gets a significant low back pain, you can suspect a osteoporosis induced fracture, and this could be one of the causes of low back pain. The next, and again, one more common cause of low back pain is a mixture of degenerative disease, which can be slip disc or also known as disc herniation, or commonly called sciatica. So let's understand what is this business of slip disc. Why does the slip disc slips? So let's understand with what is a disc. So this is a jelly-like structure between the two vertebrae. Now, what does it do? It basically is a cushion which protects the vertebrae above and below. So this disc is made up of a jelly-like structure. So sometimes there is a small rent in this disc. This allows this jelly-like structure to come out, and this leads to radiculopathy. By radiculopathy, I mean that a pain which radiates along the course of the nerve. So this is how the patient presents like. So this is how I explain this to my patient. It is like switching the bulb. The switch is in your back, but the bulb is all along your leg. And that's why the problem remains in the back. But you get a burning sensation, you get a pain, you get a numbness all along the course of the nerves. And this is what is called popularly as sciatica, a slip disc, or a disc prolapse. Now, another common cause which comes in degenerative condition is canal stenosis. So, now what is the business about this canal stenosis? So, the spine has a canal, and the nerves, which are like wires, like the way we saw in the previous slide, is goes through these canals. So, as you can see in this picture, due to disc degeneration, due to disc bulge, due to disc herniation, there is a small compromise in this canal. Actually, it means the space for the nerves to go becomes less. And this leads to a problem called neurological claudication. What does it actually mean is patient with this condition, when they walk for a certain distance, they see a symptom which is coming on in their calf muscle, which presents in the form of ache and numbness. And once they sit down, this symptom gets relieved. And this is a symptom of canal stenosis. In technical terms, we call it neurological claudication. So, when to consult a spine specialist, if you have a back pain, you can consult a spine specialist at any time you want. But even before we go there, let's understand who is a spine specialist. Spine specialist can be an orthopedic surgeon or a neurosurgeon who has undergone a training in spine surgery, or who has interest in spine surgery and has been treating spine patients for a number of years. Now, when do you really need to go and see a spine specialist? So these are the red flag signs If you get any of these signs, you should go and meet and consult one of the spine specialists. First is progressive weakness of your limb. If you feel that your limb is becoming weak day by day following a episode of back pain, this is the first red flag sign. Second, after episode of back pain, if you have lost control of your bladder and bowel, again, this is a big, big red flag sign, and you should immediately go and seek out a spine specialist. Third, in spite of getting treatment from a physician or a consultant, if you're not improving, again, at these times, it is better to consult a specialist. And last and not the least is if you are having intolerable pain, something you cannot bear with, again, we will recommend you go and see a specialist. The next is, do I need a spine surgery? If you have a back pain, do all of you need a spine surgery? The answer is no. In our practice, out of 100 patients, only 2 to 3 will need a spine surgery. Most of the patients can be treated by simple advice, the way I am talking to you now. The same thing I will tell it to a patient. They need some lifestyle modification and sometimes some sort of a medicine and exercises, and that's all you need. Very rarely will recommend a spine surgery for a simple back pain. Now, if you don't want, I don't want spine surgery, do you have an alternative? Yes. Even in cases where you are not being treated by the medicine, there is a possibility we can treat you by certain injection. These are the nerve injections which can be given to you, and this is from what we have published in one of the very reputed journals, that there is a almost a 30% chance that you can avoid a surgery following this injection. Again, there's a 30% chance that it can lead to you a partial relief of your symptom, and the rest 30% of the people, it might not help. But still, if you're not willing for a surgery, there is a alternative way of treatment. Now, before we go to the question of how safe is the spine surgery, please understand the spine surgery today is really evolved. Just the way your smartphone has evolved over a period of time. We started with something as bulky as this 10 years back, and look at the modern smartphone, they can really fit in your palm. Similarly, the modern spine surgery has really evolved in last 10 to 15 years. This is how I used to treat a patient of a disc prolapse in 2014. And 2017, we started with a smaller incision using the tubes. And today, it has gone to less than 1 centimeter skin cut. So you can see there is a paradigm shift in spine surgery today. And that has made the spine surgery very, very safe. The spine surgery today relies on a lot of instruments, a lot of gadgets. It's just not the job of a surgeon, just like the modern cars, which have GPS, which we have navigation. Similarly, spine surgery of today relies on a lot of technology. Now, these technology comes in the form of robotics, computer navigation, and that makes the surgery really, really safe. Now, is it absolutely safe? Is there no danger in spine surgery today, in spite of all the gadgets? Again, I'll give you the example of a Tesla car. Tesla, which is one of the most reputed car, is a beautiful, beautiful car with all the gadgets and everything, and it's considered one of the safest car in the world. But does it mean if you are taking your Tesla car outside, you are never going to get a scratch? You could get a scratch, but again, this is just a scratch. Similarly, in spine surgery, there are small chance that you can have a small complication in spite of no matter what you do. Again, is there a chance a Tesla car can meet with an accident? There is a chance, but that chance is very, very rare. you will hear the news that a Tesla car has met with an accident. The very fact that it is a news means that the chances of that happening is very, very rare. Similarly, after a spine surgery, something like significant damage happening to your spine is extremely rare for a simple case of a low back pain. And that is where the crux of it lies. Although spine surgery is very, very safe, but there could be a small chance of something happening, just like the way a small scratch can happen to your car when you are going out on the road. But that does not prevent you from driving your car. And that is how I tell my patients. So before we conclude, let's recap some of the points we spoke about. Back pain is the most common cause of disability in the world today. It is wise to consult a spine specialist if you have any of the red flag signs related to back pain. Majority of the patients of back pain today does not need a surgery. Modern spine surgery is very safe, and the technological advances today is making it safe every day. Thank you so much.